Hey everybody, thanks for tuning in to the AI Guide on YouTube today. And also please check us out on Facebook and Instagram and leave comments. We love comments here at the AI Guide and we try to answer as many as we can, so please leave comments. Today we're going to bring back some old favorites, and that includes AI, of course, robots, and medicine. And there was an article in Science News, which I will link below the video, that talks about the robot will see you now. So during the height of the COVID crisis in 2020, there's a big hospital, major research hospital in Boston, Massachusetts, called Brigham and Women's. And because there were so many COVID patients coming in, they were worried about their staff getting sick. So they decided to try a robot and see how people would react to that. So with about 50 people coming in to get checked for COVID, they asked if they would be willing to participate in a study, and 41 of them said yes. And the study was a robot dog from, guess who, Boston Dynamics came in. And the robot dog had sensors, and the dog could get the person's temperature, blood pressure, blood oxygen level, stuff like that. And the dog had an iPad that a doctor could speak to the person waiting in the ER over the iPad and ask them questions, and the patient could answer those questions. In addition to this, MIT, who was looking into this study as well, along with Brigham and Women's, did a survey of 1,000 people to ask them if they would be open to robots helping in hospitals, and the overwhelming majority said yes. And there's a lot of tasks in hospitals that are difficult, and the example they talk about in the article is one related to COVID, and that is that when people were having trouble breathing, they would need to turn them from their back, which the medical beds seem to all be designed for, the hospital beds, and flip them over onto their stomach, because that actually improved their blood oxygen level and helped them breathe easier. And it would take 4 people to do this. So now they're looking into designing a robot that will be able to flip people over. And the engineers at MIT are working on this right now. So we had talked in earlier videos about how Harvard Health is using robots in triage to help figure out what people's symptoms are and why they aren't feeling well. And this was another example of it being done in Boston again at Brigham and Women's Hospital. So Boston is sort of on the cutting edge of this work for several reasons. First, top research hospitals like Mass General and Brigham and Women's. Second, MIT, obviously one of the top dogs in AI and robotics. And Boston Dynamic, who makes the top dog in robotics, literally. So this is very, very interesting stuff. And one of our themes here on the AI Guide is that changes are happening rapidly now that will soon be very visible to the public. And this triage thing is going to become extremely common. Why? Because doctors' offices can handle more patients by allowing robots to check vitals and determine symptoms and stuff like that. And also it keeps medical personnel safe and allows less use of personal protective equipment, which, as we all know, was in tremendous shortage at the height of the crisis. Now, the shortage has been fixed for now, but who's to say that the next time there's a global pandemic, and there will be a next time, I'm sorry to say that, but there will be. Why? It happened 100 years ago. It just happened again and is still in progress and winding down, hopefully now, due to the vaccines. But it's going to happen again, and the time lag probably won't be 100 years with global travel and open borders and stuff like that. So all of this is to say that within a few short years, when you go to the doctor, you probably will see a robot. And that robot will do intake and check your vitals and temperature and all that stuff, and also try to understand what your symptoms are. And as AI in disease diagnostics is advancing very rapidly, and we've talked about that separately in earlier videos, this is going to ramp up fast. It's not too much to say that by 2030, many simple medical procedures will be done by robots, not just turning people over in beds, but doing nasal swabs or throat cultures, or all this stuff will be able to be done by a robot. And furthermore, there's been a shortage of nurses for many, many years. And so this is one logical way to cure that shortage of nurses. That said, I have said that for those of you looking for an AI-safe career path, which we always talk about toward the end of each video, nursing is one of them. Why? Because the human touch will still be needed for the foreseeable future in nursing. So you will be able to have an entire career by starting out in nursing today, unlike some other things like starting out a career today in driving limos or driving trucks or working in a warehouse or stuff like that. You will not make it through a full career. So in that same job. So that is why we're working on resources to start providing shortly. And we've been trying to get all that finished up, and it should be very soon. But in the meantime, think about career options that still require this human touch, and nursing and being a doctor is one of them. AI will work alongside doctors and nurses for quite a while. It will be a long time before robotics and AI advance to the point where nurses and doctors might be eliminated. Probably not in people's 30-year horizon. Who knows, by 2050 anything is possible. Literally anything is possible, but that's a long way to 2050. So thanks a lot. Hope you enjoyed this. Take care, and the link to the article from Science News is below. Take care. Thanks. Bye.